Hello everyone, good morning. So today I am going to talk more about dermatology, especially this is concentrated for those who are appearing for MLA exams. So let's start about hot tub folliculitis. So what is this? This is this knowledge is about the infection which is caused due to Pseudomonas aeruginosa in a vulnerable group. Say for example, they will give you questions like a middle-aged female who is diabetic and frequently uses a hot tub, and they will show you an image. The image will not look like this. You can Google about a hot tub folliculitis. This is just an AI generated one, and they will ask you about the reason or the diagnosis. So the diagnosis is hot tub folliculitis and the most common agent is Pseudomonas aeruginosa. What about the follicular infections? Follicular infections, there are many various terminology which we should know. The first one is folliculitis, the second one is furuncle, the third one is carbuncle, and how to manage all these. Folliculitis is nothing but it is inflammation of just one hair follicle around the hair follicle. So that is known as folliculitis. But on the other hand, the abscess involving a single hair follicle, this is not an infection. Now here we are having an abscess. So abscess involving a single hair follicle is known as furuncle. But when the adjacent abscesses all coalesce together, it forms a carbuncle. So a cluster of abscess or boils coalescing into a single cutaneous cavity of pus is known as carbuncle. So how do you manage a carbuncle or abscess in general? So the main idea is whenever there is an abscess, just mere drainage of the abscess will help to cure it. So drain the cutaneous pus collections, and it is advised to leave that area open with a sterile gauze such that the gauze has been stuffed into that area, and pulling out slowly every day will help to treat the infection. In addition to, now we will see about Bartholin gland abscess as well as Kawasaki disease. Bartholin gland abscess is nothing but it is mostly seen as a painful 1 centimeter lump in the labia majora. What is a common etiology? This is asked in MLE exams. Polymicrobial etiology is the most common one. Now, how do you treat Bartholin gland abscess? Even though the etiology is polymicrobial, just warm compress for the cysts or drainage of the abscess will help to cure Bartholin glands. This is because warm compress for the cysts will help to liquidate the material which is present within the cyst, thereby helping that to drain. But in some cases where the drainage doesn't happen, then medical drainagement of the abscess will also help to cure the Bartholin gland abscess. What about Kawasaki disease? Kawasaki disease is mostly seen with children with 5+ days of a fever along with desquamation of the palms and soles. It also presents with the conjunctival injection as well as lip changes and all. So the main treatment for Kawasaki disease is aspirin. Generally, aspirin is not given in pediatric age group fearing Ray's syndrome, but the only indication where aspirin can be given in children is Kawasaki. Sometimes IVIG can also be given to prevent coronary complications. Why? This is because I will tell you in detail about the etiology of Kawasaki disease. The Kawasaki disease generally is because of abnormal immune response causing vasculitis. So when there is an abnormal immune response, apart from aspirin, aspirin helps to treat vasculitis to some extent. But if it is profound because of the immune response, then IV immunoglobulins helps to stabilize the body from the abnormal antibodies which is produced by the body against the body. So therefore IVIG is helpful. So this is the main criteria, 5+ days of fever with desquamation of the palms as well as the soles. So if it is left untreated, then coronary artery abnormalities can happen. What about Rocky Mountain spotted fever? Rocky Mountain spotted fever is mostly transmitted by ticks. The rash pattern will be very typical such that it will be centripetal spread. First it will start at the palms as well as at the soles. Then it will proceed on to the wrists, ankles, and then towards the trunk. The main treatment is doxycycline for patients more than 9 years old. But in children and in in pregnant women, doxycycline is contraindicated. Therefore, either amoxicillin or ceftriaxone can be given. How will this knowledge be tested? They will be giving you like a, a teenage girl or a middle-aged lady who lives in Connecticut, some areas where the ticks are more prone, went for hiking 5 days ago. Now they are having rashes in the wrist as well as the ankle, and the rash migrates towards the chest. What is the diagnosis and treatment? The diagnosis is Rocky Mountain spotted fever, which is caused by Rickettsia rickettsiae. And they will also ask you about the treatment, where you should know about doxy and amox or ceftriaxone. What do you know about hand, foot, mouth disease? Hand, foot, mouth disease, you need not remember anything. The hand is involved, the foot is involved, as well as the mouth is involved. So that's why it is very simple, as simple as that. So now what you need to know is that what is the organism that causes this and what kind of virus is that. I mean, whether it is an RNA virus or a DNA virus, whether it is enveloped, whether it is segmented or not. So that is the knowledge that they will test you. Say for example, they will give you like a young child who has vesicular eruptions on the bottom of the feet as well as palms and periorally. What is the most likely causal organism? Organism is Kawasaki A virus, of course, but they will give you options like whether it is an RNA virus, whether it is DNA virus, whether it is segmented, non-segmented, enveloped, or non-enveloped. You should know that Kawasaki virus is an RNA virus which is non-enveloped and it is non-segmented. Fine? Okay. The other one which you should know that this Kawasaki virus can also cause something known as herpangina, which is posterior oropharyngeal vesicles. Now we have seen about the RNA virus, which is Kawasaki virus. Let's see about a herpes simplex virus, which is a DNA virus. So herpes simplex, you should know for sure how it is. It is a DNA virus, it is a linear virus, and it is an enveloped virus. How will the primary infection be? Primary infection is nothing but it will present with a fever, lymphadenopathy, nothing. So how will this knowledge be tested in exams? They will ask you like a 24-year-old male who recently returned home from military service. Sorry for the interruption. This is how the question goes. A middle-aged man who recently returned home from military service and has a fever of 101 degree Fahrenheit with cervical lymphadenopathy and posterior oropharyngeal vesicles. Painful vesicles inside the lip. Okay, so you should know that nothing is on outside of the mouth or the lips. Question asked, what is the next best step in the diagnosis? So here the answer is HSV, herpes simplex 1 or 2. Here if you see, they have given that the question, if you had noticed, I told you about posterior oropharyngeal vesicles. Even though posterior oropharyngeal vesicles is pathognomic for Kawasaki virus, it can occur in herpes simplex virus. But painful vesicles inside the lip, Kawasaki doesn't cause painful vesicles inside the lip. Okay, so therefore now here this suggests towards herpes simplex virus 1 or 2. Okay, and what is the next best step in the diagnosis? Answer is PCR testing of the vesicles. We are not going to do viral culture for the virus that is present within. We only do PCR testing for the vesicles. PCR testing of the vesicles to find about the virus. Okay. Next, they will be giving you something lip picture with herpes labialis. So this is just an representation of the lip. I couldn't find a better picture, but you can search it in the net. So here Similarly, they will be asking you about the virus structure, that is, it is a DNA enveloped and a linear virus. Then the vesicular eruption which is present on the lip, that is herpes labialis, can undergo ulceration as well as crusting. Now, what is the treatment? Acyclovir or valcyclovir will shorten the duration. How does this happen? This happens because the virus remains latent in the ganglia with periodic reactivation. Now, how will this be asked? They will show you an image of the herpes labialis, and the question will ask you what is the most likely organism in terms of viral structure. Here it is, we know that it is a H.simplex virus 1. They are testing you about the knowledge that the virus is DNA, linear as well as enveloped. What do you know about herpetic whitlow? Herpetic whitlow is a condition where the direct inoculation from the herpes cold source happens to the fingers. So how does this happen? So when a patient comes to the dentist or else any dental hygienist, and when they have the herpes infection, and when the dentist or the people who are exposed to it meddle with it, then the virus gets inoculated, and they have increased exposure risk. Now they will be showing you this picture, which is a picture of the herpetic whitlow, and they will ask you about the mechanism of the treatment. So here you should know that the treatment is acyclovir or valcyclovir. They will cause the DNA chain termination by inhibiting the DNA polymerase. The chain termination is inhibited by DNA polymerase. So the mechanism of action is DNA polymerase inhibitor. Now they will be showing you a fingernail with arsenic lines, just almost similar to it. Now you should know that arsenic is present in the fertilizers. So farmers, gardeners who are exposed to the fertilizers will have arsenic lines. So they will be having white transverse lines or Mees lines. So how will this knowledge be tested? They will give you a question like a middle-aged man who's a gardener, and they will show you a picture and they will ask, this is due to what type of toxicity? Answer is arsenic. Mees lines are white lines which are seen on fingernails in arsenic toxicity. Arsenic is that which is present in fertilizers because it causes the plants to flourish. So any gardener, any farmer, any landscaper are at increased risk of arsenic, and they can even result in rashes of the palms as well as the soles, which are known as arsenical keratosis. Orbital cellulitis. Orbital cellulitis is a condition which is caused by Staph aureus. It can be because of any reason, but it most often follows the sinus infection. Here the eye will be so painful, the patient will be swollen, and it will be having a restricted eye movement. They will also have additional fever. Here it is a medical emergency which has to be treated promptly with IV antibiotics. Fine. How will this knowledge be tested in the exams? They will tell you a child who had a recent paranasal sinus infection now presents with a fever of 103 degrees with a painful swollen eye, and they will show you an I2. What is the diagnosis and how are you going to treat it? So you know that the diagnosis is orbital cellulitis. Here there is infection involving the tissues posterior to the orbital septum. Where is the orbital septum present? Orbital septum is present in the eye, whereby posterior to the orbital septum is much more severe than compared to the anterior to the orbital septum, which is known as preseptal cellulitis. Since this is caused by Staphylococcus aureus, here it is a medical emergency which requires IV antibiotics. You should also know that preseptal is less severe version of orbital cellulitis. What is Hordeolum or stye? Hordeolum or stye is nothing but there will be a sweat gland or else the oil gland which is present in the eye, in the eyelids. So any infection of the sweat gland or the oil gland is known as hordeolum or stye. Most likely the infection is caused by Staphylococcus aureus. So they will be giving you a 30-year-old female with a painful red bump on the upper eyelid, similar to this. What is the characteristics? It will be painful, it will be tender, and it will also be erythematous. What is the treatment? Treatment is warm compress. Even though this is caused by infection such as Staphylococcus aureus, any warm compress will allow it to liquidate the fluid which has been inside, and once it has been liquidated, it will easily flow through such that it can easily flow through such that then the hordeolum or the stye gets cured even with warm compresses, and it does not require antibiotics. Similarly, chalazion is a blocked oil duct, but here there will be no infection. Again, here it has to be treated with warm compresses. Okay, so in step 2 CK USMLE, they will ask you questions comparing the hordeolum or stye with the chalazion. So knowledge is much more important. What about the syphilis? Syphilis, there are 3 stages. Let's first see about the first stage, that is a primary syphilis. In syphilis, the most important thing you should know is that there will be a painless penile ulcer. What about the where then in that case where will painful ulcer occurs? Painful ulcer can occur in herpes simplex, or it can also occur in Haemophilus ducrei where it causes chancroid. So when there is a painless ulcer in the penile shaft, how will you confirm the primary syphilis? Primary syphilis confirmation is by dark field microscopy. That's what you should know. There are many different ways to diagnose syphilis at each stages. In primary syphilis, it is used to confirm by dark field microscopy to visualize the spirochetes. How is this treated? This is treated with penicillin. If you see, this is a picture of the secondary syphilis. This almost looks like a pityriasis versicolor, isn't it? But this is secondary syphilis. Since they almost look like pityriasis, the question will very clearly say the KOH preparation is negative, which means that it has ruled out tinea versicolor. In this case, that is in secondary syphilis, what is the confirmatory test? Fluorescent treponemal antibody confirms the diagnosis. Even though VDL, RPR are tests which are used, but they are not confirmatory because they can be positive in other situations. Such as when antiphospholipid antibody syndrome, the VDL RPR can be positive. Therefore, confirmatory is fluorescent treponemal antibody will confirm the diagnosis. Tertiary syphilis. So they will give you a characteristic granulomatous lesion, which I again ask you to check in the internet about the granulomatous gamma, which is present on the forehead. It is very typical. So when you see a picture of a gamma, it clearly implies that it is tertiary syphilis. Tertiary syphilis is the one where it will be affecting the cardiovascular as well as the neurovascular system. In cardiovascular, it will result in ascending aortitis associated with aortic regurgitation murmur. So how will this knowledge be tested? They will tell you like 24-year-old patient or any age, history of unprotected intercourse, recently immigrated to US from Egypt, presence with below lesion, and they will show you a gamma. And they will also tell you that there is 2/6 decrescendo holodiastolic murmur. So aortic regurgitation murmur is a holodiastolic murmur, isn't it? So that's what they mean to tell you with this statement, auscultated on exam. The most likely causal organism bears taxonomy most similar to which of the following? With the above ignite, you should be able to find out that it is a spirochete and the reason is syphilis. What are the other spirochetes? Other spirochetes are Leptospira as well as Borrelia. So now you have to choose either Leptospira or Borrelia. So Borrelia burgdorferi, in Borrelia there are two diseases which is caused by Borrelia burgdorferi causes Lyme's disease, while Borrelia recurrentis causes relapsing fever. Tertiary syphilis can cause ascending aortitis, which is what I told you, that the murmur is aortic regurgitation murmur. Thank you for listening all this while. I am happy that you have come to the end of the slide. I hope this is helpful to you. If you have any questions, you can write to me. I am more than happy to clear all your doubts. I have an announcement for you. I am starting my mentoring lessons for medical graduates and USMLE aspirants. If you like my videos and if you like the way I teach, you can sign up for my mentoring class. I can't wait to see you succeed. Thank you. Have a good day.